Prosthetics were made out of leather and wood. These early devices were developed for artistic purposes and were not functional. When science came into the world of prosthetics, leather was abandoned and metal and wood became the important materials for replacement. During the Punic War, an iron hand was created. Decline of scientific development limited those in need for prosthetics to hook hands. Only those people who were wealthy could have prosthetics that resembled the hand. The surgical procedures developed so that prosthetic iron hands were capable of moving at the joint. Prosthetics during this period were generally made of iron, steel, copper, and wood. Rubber hand was invented. The fingers were flexible and would yield under pressure, having sufficient elasticity and adhesion to hold light articles. It presented a natural appearance and was pleasant to the touch. It was far more durable than the wooden hand. In the 1960s, Russia produced the functional moving hand. Today, electrical hands with strong silicone covers are in wide use. The future of hand prosthetics depends on the development of myoelectric control. Today, myoelectric control is the best form of neuromuscular control. However, in the future, electromyogram pattern recognition will be possible, and it is crucial that such technology be utilized for multifunction control of prosthetics. If that area of research is developed, the future will allow individual finger movements and coordinated movements of the hand, wrist, and elbow. Neuroelectric control is a more advanced form to monitor impulses between the motor nervous system and the brain. When these direct impulses are recognized, better human-like finger movements can be performed. First, there is a risk of infection after a prosthetic joint implant. In some patients, healing of the wound becomes very difficult. Therefore, grafting of the skin is required to treat the problem. This problem arises only after a few years of surgery. This happens because the prosthetics may wear out or tear with the passage of time. Normally, the prosthetics last for nearly 20 years, and they need to be changed again. This is a common condition which can happen during the process of hand replacement. Bones that are replaced are carpals, metacarpals, and phalanges. And these are the hand muscles that are to be replaced. The new users need time to get used to the movements of their prosthetic hands. The hand prosthetics can be extremely uncomfortable, and there can be causes of injury to the area where it joins with the arm. Prosthetic users should only be allowed to compete in the athletics competitions that are only for those with the prosthetic limbs. It is unfair for the non-prosthetic users to compete those who have higher energy due to the support of the prosthetics.